talking about. That's all. And,
But you know, they're not having no glass.
that too.
You spend all this money.
And they got a nifty 50.
So they said somebody else, one of the professors said that there's another meeting in progress.
Okay, I'll double check.
Okay.
Sure, Hampton could get you some RGB joints and hit some color on this wall.
Oh yeah, man, this wall is terrible, but I think these lights come on. Maybe I should try to figure that out.
Because this is pretty yellow.
Yeah, it's pretty warm.
That was it. So you just have to show.
We're in business. I'm just gonna check it real quick.
Yeah,
This is straight.
and this all you need.
That's all you need, man. And OBS, keep it simple.
Yeah.
Yeah.
See,
I mean, I've got a Black Magic here. My other tripod comes, I'll put it right there. But
oh,
literally,
that's a wireless one?
yeah.
Oh.
But I'm nuts, so I just like to plug in when I can.
No, I like that too. I just
You
haven't
never
had
know, bro.
I haven't pulled the trigger on that purchase.
Oh, no.
But I get it.
Let's do some stuff together. I'm always doing streams and stuff.
Okay.
And, I always need some more glass and just like light and something. There's always.
Oh, are you kidding, bro?
I'm serious.
No, I'm
Actually.
saying it's like I got RGB panels in the truck. I got what do you call it?
Your name's Levi? What's your name? What's your name?
Sam.
Sam. Spell it.
S-A-M?
Sam. Okay. Sam.
Yeah,
I'm
Sam.
Andrew.
Yeah.
Yeah. Usually it's the orchestra, but
Yeah, that's
I be doing all of it, man. Like I used to do all the concerts myself, but now I got production crew, but they're so expensive. I have to do some of it on my own, and I've always been a photographer. Like I used to have a studio. I used to shoot like clubs and
I had no idea.
yeah, man. I'll see you my website.
Yeah, I was like, I thought you were just doing the music stuff.
I do all. I go back and forth, but
It's funny because I play too, so that's why.
of course you do.
Yeah.
What do you play?
I play keys.
Of course. Yeah.
Yeah.
That's beautiful, man.
That's hilarious.
Hey, man. It's
I have a problem like kind of over volunteering
Oh,
helpfulness. So I'm trying, but I want to go put some lights up so bad.
I know.
Oh man,
Let's
I'm gonna
see
be
if we can
hating.
get this. Yeah, let's see if this will come up a little bit.
Good evening, all. Good evening. This is typically where I would say good evening and a very warm welcome. But tonight I have to hype it up a little bit. I have to hype it up a little bit. Let me tell you why. So I'm going to say good evening and a very elated, ecstatically happy, over the top, and warm welcome to our very first Community Health Worker Certificate Ceremony event. I am Christina Lynch, Director of Trinity at TheArc. And on behalf of Trinity Washington University, I would like to thank all of the administration, the professors, and the students for being with us and gracing this event. I would also like to thank some of our guests, some of our special guests this evening. With us tonight, we have Mr. Pablo Venturino, Director, DOS American Job Centers and One Stop Operation. We have Dr. Walter Lundy, Finance Officer, Workforce and Federal Programs Bureau. We have Ms. Jasmine Smith, Program Manager. And last but certainly not least, we have Dr. Mary Roach, President of the Jehovah Jireh Community Development Center, also known as the JJ Center. I would be remiss if I didn't talk a little bit about Trinity here at TheArc. So if you would allow me, I'd like to take just a brief moment to tell you a little bit about our programs here. I joined Trinity in 2017, but to my understanding, Trinity has been housed here at TheArc for an estimated 14 years. We began with one program, the Associate of Arts in General Studies, and then in the fall of 2019, we reinstated the Early Childhood Education Program. And then in the fall of 2021, we then had the Associate of Arts in Health Services. And that degree was our first stackable degree. As part of our Associate of Arts in Health Services, embedded into that program is also the Community Health Worker Certificate. Right? Yes. Thank you. Our program is mainly for working adults. Our classes are held in the evening, and we have an estimated 150 students. But tonight, we celebrate 12 of those students. Yes. 12 students who have met all requirements, 6 classes, 18 hours, and thereby successfully obtained the Community Health Worker Certificate. Tonight's purpose is to celebrate you and your accomplishment. In celebrating this achievement, tonight's program will include presentations from key personnel, recognitions, an information session, and most importantly, the dissemination of certificates and plaques. As you can see, we also have refreshments. Trinity and the Department of Employment Services, DOES, has truly come together. We've partnered to make this a quaint and memorable event for you. Again, thank you for being here tonight. To help us get started, I have Dr. Nicole Betchman, Director of Health Services.
All right, congratulations. I am so incredibly excited that this has come together. You were our very first cohort, and I could not have been more pleased with everybody and all of your hard work. So I wrote up just a little bit about community health workers. So after obtaining this certificate, and you're now joining over 60,000 individuals in the United States who have the training to be a community health worker. So you're joining a huge community. There are so many different organizations that are in this community right here and throughout the United States that need community health workers. And Dr. Roach is going to talk a little bit about that and the impact that you guys will have on your own communities. As a community health worker, you are trained to be an advocate, to be that link between the medical home and the community, and to be a trusted resource. As we know, a lot of times in marginalized communities, trust is not there because a lot of times we can't speak to people who look like us. So being from the culture, the community, having the same language is extremely important in improving the status of individuals' health and wellness. So each class that you took had a different perspective on health and how different issues impact marginalized communities. Looking at policies and politics, how that impacts us as individuals and obtaining access to health services, to patient advocacy and the community health worker class. How can you be that advocate? And then also that health and wellness programming class, how do you even create a program targeted towards that actual community, knowing that every community is going to be different, therefore every program is going to be different. So congratulations again. I'm so happy for you guys. Yes. So the shared values and experiences of community health workers as an important piece of the puzzle that is often missed in healthcare. With your training as a CHW, so after your name, you can put your name, comma, CHW, because you are now trained as a community health worker. And I hope that is, for me, I know when I had to put letters behind my name, that was like the most exciting thing. So I hope it brings you as much joy that it did to me as well. So with your training as a CHW, you are now an integral part of increasing the health and wellness of this community and other communities as well. So congratulations again. All right, so now I want to recognize who were very integral in providing the education for this program. It was Ms. DeWanna Brown, who is online, and then also Ms. Jada Cummings as well. So they were specifically chosen by myself due to their background in the community and in DC, working for various parts of DC government for improving the health and wellness of the community. So they were chosen for a reason because I knew their background and I knew that they could provide more of a well-rounded experience for the classes. Now I would love to introduce Dr. Roach. Dr. Roach, I met her, with the pandemic, I forget how many years it's been. So I'm going to say 4, but it's probably longer than that. And she actually helped with our internship programs and providing experiences. And she reached out to me about something special that she has been working on. And then I instantly thought of my DOS cohort, and I was like, oh, yes, we can definitely, use her as a resource. So I'd like to introduce Dr. Mary Roach.
Thank you, Dr. Beshman. Thank you. Thank you for allowing me to speak. Again, my name is Dr. Mary Roach. I'm a president of the JJ Center, a faith-based organization that I'm also a clinical pharmacist, and I believe in community health workers. Y'all are awesome. Y'all are great. You do wonderful work with the training that you have. Additionally, with the layman's way of communicating with the community, you make a difference in their care. Like I said, I'm the president of the JJ Center. It's a free free food and health education, and now the patient health advocacy piece, which is done by you, the community health workers that go into the community. The best, okay, we have over 2,000 families that we serve through giving free food to, and everyone can meet over free food. And we have discussions, health discussions. We have another partner, her name is Kimberly Mason, that even has some of her healthcare providers, health community health workers going in and looking at behavioral health and screening for that piece too, which you come aboard with us, you'll learn those skills and go into those areas because it's very important, especially with the COVID. It has made things a little more difficult. And then we're in Ward 8, where you see a lot of the health disparities. We see a lot of women that need prenatal care that are not getting it. And so it's kind of sad, but with you, you can make that difference. And also with diabetes. Type 2 diabetes is running rampant in the Ward 8 community. We don't have to even identify one culture against another. Blacks in there are even 2 times higher than the rest of the United States. And it's horrible. So we want to prevent the advancement of diabetes. They trust you. You can win their trust because you're part of the community that you go into. And you have an understanding of what they're facing. And you're well needed. Well, some of my community health workers have identified one lady that had breast cancer. We've identified someone that needed help with sickle cell anemia. As you know, there's serious pain associated with sickle cell anemia. That if you go to the emergency room, they're going to think you just need drugs for your pain, which that is not true. So we need you. We need you. You're awesome. Congratulations. I am so proud. I'm so happy. Thank you.
Have you heard that phrase where it says it takes a village to raise a child? Yes. Well, it takes a coalition of partners to educate, to provide services. And so it gives me great pleasure to introduce you to Mr. Pablo Venturino, who is with the Department of Employment Services, DOES.
Good evening, graduates. Good evening. So I'm here on behalf of the District of Columbia Department of Employment Services and Director Unique Morris Hughes to recognize your commitment, hard work, and drive from this training program. So let's give it up for you. I'm just saying really quick about DOES. Our mission is to connect district residents, job seekers, and employers to opportunities and resources that empower fair, safe, and effective working communities. Supporting you and the Community Health Worker Program couldn't be better aligned to our mission. So again, I give it up for you and Trinity for putting such a great program together. At DOES, we are extremely proud of you and excited for the work that you will provide to district residents. Completing this program is a big achievement, and now we look forward to seeing how you put your new learned skills to the test. We want to thank our partner, Trinity University, Dean Tracy Cook, I don't want to miss anybody, Dr. Roach, and Dr. Betchman, and all the Trinity staff for all the great work that you've done. It's been a pleasure to work with all of you. Thanks for making this happen. Also, I'd like to thank our DOES staff. All of them, but in particular, Dr. Lundi. You don't need to know this, but all the hours, all the work, all the energy that he has invested in making this happen, it's been tremendous, and he's been, number one advocate on behalf of the director, Unique Morris Hughes. So thank you, Dr. Lundi, for all you've done. And thank you, Atrell, for all your support. In closing, at DOES, we hope that every graduate can return to their community and tell their friends and family members about the great work that took place here. We want you to remember all the challenges you overcame to get to this point, and continue on to achieve great things for yourselves, your families, and our communities. Congratulations, graduates.
Thank you to our partners, DOES, Dr. Roach with the JJ Center. It truly takes a coalition of agencies to make this happen. So we're very grateful for you all. Thank you. Yes. Now the moment that we have all been waiting for, the moment that you all have been very, very anxious and excited about, the dissemination of certificates and plaques. And for that we have Dr. Betchman, who will be disseminating certificates. And then we have Mr. Pablo Venturino, who will provide plaques. Okay. Dr. Betchman.
So I'm going to call everyone's name who is here. And I know there's some individuals who will not be here, so I have them in the back. But I will be calling everyone's name. If you are not present, we will make sure you get your plaque in your certificate. So the first one I have is Desiree Coley.
I feel very grateful. Thank you all for the opportunity, and I'm just thank y'all.
Congratulations. Take a picture.
I'm vaccinated. Can I take my mask off, or you prefer for me?
No, you can take it off. You can take it off. Awesome. Congratulations again.
All right.
All right. The next person, Jamise Davis. Congratulations.
Thank you.
Congratulations.
You can stand in front and I'll get your picture.
Take the.
Yep. You can if you want to.
Ooh, I didn't pop the y'all.
That's okay. Ready? This one, right there. Good job.
Thank you.
Congratulations. The next person we have is Tracy Givens. Congratulations. Nice to meet you.
Thank you so much. Thank you for the opportunity.
I'll take a picture. The next person, Tiana Jones. Make sure I pronounce that right. Congratulations.
Thank you. So cute. I did it, everybody online. Thank you.
Just take it.
This ain't my bag.
And for those that are online, I just want to let you know that I would like Tayana's boots when she leaves. Because they next, Kathy McMillan.
Thank you. Nice meeting you. Thank you.
I'll get your picture.
Yes.
Softball skills. Good job. Okay, thank you. Okay, we have Janae Poston. Next, Raquel Richardson. Mona Triplett. Joy Burke. Catrice McKinley. Tina Nelson. And Gina Pryor.
Thank you so much. Thank you.
Congratulations.
Congratulations.
Thank you. Thank you.
Yep. Okay. That concludes our dissemination of the certificates. I'm going to pass it back to Christina, Ms. Lynch, to talk about anything else that, oh wait, I'm sorry. I just talk about the Associate Arts and Health Service. So as you know, I'm the Director of Public Health and Health Services Programs at Trinity, and the way that we design this, like Ms. Lynch said, is that it is a stackable program. So all of the classes, the 6 classes that you have successfully completed, will stack into an associate's degree of health service. Those classes never will expire. So even if you do it in the fall or 5 years from now, you can still come back and still have those classes ready to go. That is for main campus as well, still going to transfer here or on main campus. With the associate's degree of health service, it transfers into the bachelor's of health service. With the bachelor's of health service, for some students, they want to take 2 master's classes in their senior year. They can do that and get started on their master's degree while they're still an undergraduate. Yeah, you gotta think outside the box, and make it better for us, right? So we have those opportunities. So I just want to let you guys know that it is stackable. It's very rewarding. The way that health services came out here in the first place was because a student asked about it. And they said, why are you not over here? And I said, I don't know. Let's go out there. And that's how we got the ball rolling. So I look forward to seeing you guys in the community doing good work and possibly back here, either at the ARC or on main campus. So you have all of our information. You have your professors' information as well. Use them as a resource, AKA reference for anything. Just email them prior to and let them know and ask them if you can use them as well. I have an open opportunity. You guys can use me as a reference. I tell all my students that. So I will now pass it on to Ms. Lynch to close out the program.
Well, in closing, I would just like to say, and this is the part where I tear up sometimes, so please forgive me, but I cannot state enough just how proud I am of you ladies. I know that this is a major milestone for you, and I'm deeply, deeply, deeply proud of you, and I hope that you would continue, because this was just step one, right? Yes. I'd also like to again state the importance of our coalition and our partners, that with us working together, we uplift others, right? This is what we do. This is why we're in the game here. So thank you. And that's basically it. We have some refreshments afterwards, and to my understanding, we still have some interviews. But in closing, I cannot say enough how proud I am, how elated I am to work with you all. And this was our very first class coming through. So. Thank you again. Thank you again, and good night. Feel free to have the refreshments and oh, some pictures. Okay.